Dr. Akun Sabharwal, Director, Drugs Control Administration, Government of Telangana, to please come on stage and put your views. Thank you, sir.
Good afternoon. I'll not take too long. My field is slightly different from what the other speakers have been speaking. I don't work in, I work in an organization called the Drug Control Administration, or what a lot of states would know as the Commissioner of Food and Drug Administration. I belong to the state of Telangana, the new state of Telangana, that is Hyderabad and surroundings. And just a brief background, we are the biggest players as far as pharmaceutical is concerned. We manufacture almost 40% of the country's medicines and 80% of the country's vaccines. And my job is basically licensing them. So regulating the manufacture, distribution and sale of medicines in the state. So manufacture regulation is one of my bigger duties. I'm here in Bombay today actually to participate in a CEO's conclave of pharmaceutical manufacturers at ITC Maratha. So I dropped down here for a presentation. It's also availability of standard quality of medicines at standard prices. So basically I'm a regulator. I'm a cop by service, I'm a police officer, but over the last 1 year I've been regulating the pharmaceutical manufacture in the state. I'll just be brief about, these are just statistics. We have about 490 big manufacturers in the state, and I also regulate what you call the pharma stores or the chemist shops. So Telangana itself has about 28,000 pharmaceutical shops, so that also is part of my duty. This is something that was more useful to the other group, but we've shifted to online licensing. It may appear very strange to all of you in the IT world, but most of the pharmaceutical regulation still happens on paper and pen. And thinking of online itself is a big shift. In fact, not only have we gone online, we've also done something called flow charting and timelining. So in the state of Telangana now, we assure you that if you want to set up an industry, we'll give it to you in 30 days. So there is something called making of flow charts and timelines, because of which we are able to do this, and there is also a penalty clause. So if the file is stuck up at any table, there's a penalty clause of 1250 rupees per day beyond 30 days. So the concerned employee pays through his pocket. And this is mandated by an act of the government. It's called the Telangana State Industrial Policy Act. So it's mandated in an act. How we do it, it's your simple barcoding and file tracking systems, which are common to the IT world, but something new to the job that I'm doing. Website, nothing, but yeah, we've mandated everything that is there is now on the website. So if you want to apply, it's there. What documents you require, it's there. The whole process is online now, both for manufacture as well as for your pharmacy shops and druggists and chemists. This is what I was talking of. We've actually, everything has been broken down into how long will each step take, and therefore if you don't follow that, we penalize ourselves. I'm heading the department. Yeah, this is something, again, just have an idea. Across the country, regulation happens in terms of areas. So Hyderabad, Secunderabad, Rangareddy, district-wise, a lot of previous speakers also were talking. We've shifted from that approach to something called the verticals. So there would be a specialized team looking after cosmetics, a specialized team looking after vaccines. US is the only other country which does it. We've taken it from US federal regulators and we've implemented it in our state. E-labs, again, most of the medicines that you take, how do you decide that these medicines are good or bad? The government drug inspectors regularly pick up samples at random from the field and send it to laboratories for checking. What happens is that the big pharmaceuticals and the small pharmaceuticals are able to grease palms and ensure that the samples are either changed or yeah. So a lot of things happen. So what is being done now is using technology, the sample is picked up, all are barcoding. So you take it out of the package. So if you're taking Disprin in the market, the moment the drug inspector picks up the medicine, he removes the cover, puts it in a plastic pouch, puts something called a QR code. Most of you would be using it, but we've given all our drug inspectors on their mobile phone. So we are not even giving them pads or extra devices. The same has been loaded as an app on the phone. So a QR code is generated. The medicine is couriered to the lab. so you don't actually take it. So the courier service itself has its own tracking system. Again, jumbling is possible. In the lab also, nobody knows which sample has come from where, because it's only a strip or a QR code which is there. It's something very simple to people in the technology field, but putting it into government use for drug testing. In fact, just for your knowledge, in this country, on an average, what is called as not of standard quality drugs, NSQ, on an average in a month for the whole country is about 60. And my state alone, over the last 9 months, we have been giving 40 plus. It's not that the quality of drugs in Telangana is bad, but we are cutting down on loopholes. So that is there. E-regulation to M-regulation, this is something we've shifted over when we go to inspect. We've shifted to a mobile app. It's called the Drug Regulator app. It's available. I don't have time and I'll not bore you with it, but it's basically an app which has been developed keeping in mind all the legal provisions of the Drug and Cosmetic Act. And there are 2 or 3 benefits for it. You see, one, the drug inspector is normally a team of 2 or 3 who go to inspect. They keep on doing it. They are doing different facilities at the same plant. So either they are going to a manufacturing unit or they are going to a pharmacy. The parameters are the same. 2 or 3 reports generated at the same time, consolidated at the same time, and any deviations between the reports are brought forward. So it ensures, one, that everybody, you see, all three of us or 4 of us can sit on a table and one person can write the report. But once all 3 of you have to feed it into the system, and everything that you're feeding in is going back to the headquarter unit, ensures that, one, you do your job properly, secondly, you ensure that the quality improves, and a lot of time and manpower saving. In fact, we had US FDA people over to our facility in Hyderabad, and they were quite impressed by it. Even the US doesn't do it. So these are a few things that we've tried at our level. I'd love to explain. I leave my mail ID and my mobile number. Anybody who would be interested in knowing anything more about it, I'll be more than happy. Thanks for taking your time.